Hello friends, I wanted to come out and talk about a situation that I went through last summer in hopes that it might help one or two of you if you happen to be going through something similar. Back in August, I had emergency surgery to stop some pretty substantial internal bleeding caused by a ruptured ectopic pregnancy. And it was a very scary and painful experience, and I had a really challenging time finding people who had come forward talking about this particular experience. It is common. It's not, as common as, say, a just chemical pregnancy or a early miscarriage or something like that, but it is something that is relatively common but not talked about very much. So I thought I would share my experience in hopes that it might help someone out there going through something similar. If you are going through this or think that you're possibly going through something like this, I would love to be kind of a virtual support for you. Like I said, I felt very alone in this process, and I wasn't very educated on exactly what an ectopic pregnancy was and the steps that you would have to go through in order to remedy it. I learned a lot through this experience, and I want to, as briefly as I can, share what I learned with you in hopes that maybe it will help you make some educated choices and advocate for yourself if you do find yourself going through this. So first of all, an ectopic pregnancy is any pregnancy that happens outside of the uterus. Now, in order for a pregnancy to be viable, it has to be in the uterus. And so by nature, this is a pregnancy that will not continue on to be viable. So in my case, the pregnancy happened inside of my left fallopian tube. And there were a lot of different signs that were very apparent early on in the pregnancy that in retrospect make a lot of sense as to what my diagnosis ended up being. But I thought if I just threw those out there for you guys, you can maybe piece it together before it's too late, which it ended up being for me. But this is something that you can maybe be a little bit more aware of if you have similar symptoms that I did, and maybe you can advocate for yourself with your doctor just to get some, early ultrasound or get your HCG levels checked more often if you think that this might be something that you're going through. Now, they usually end up in the fallopian tubes. Most ectopic pregnancies are in one of the two fallopian tubes. And the reason that this happens could be caused by just a number of different things, none of which are your fault. So I don't want you to feel like you've done something wrong in order to have this sort of an outcome. And we'll talk a little bit more about the emotional part of it later. But, it can be caused by IUDs, definitely contribute to having an ectopic, age, random factors that we don't know. Egg being just a little bit slower and being fertilized in the wrong place, obviously. Hormone imbalance. There's just a lot of different things that can contribute to this happening. So I've had 6 successful pregnancies. I have 6 beautiful children. And I think it is helpful to know that, I've had these 6 experiences where I've had really healthy, wonderful pregnancies, and then I can contrast that to, this particular pregnancy, which was my last, and kind of compare and contrast these and be able to tell you what I noticed early on as a difference. So the first one was that I had a full period right before I got my positive pregnancy test. And I know this can happen, but generally doesn't, especially with me. A period sheds the lining of your uterus, and if there is an egg newly attached, the probability of that egg not being able to survive that shedding of the uterine lining, is pretty high. So the fact that I got a very, very dark positive pregnancy test right after I finished my period was really strange to me. So that was the first thing that tipped me off. And the reason why I tested was because I was getting those early pregnancy symptoms that I've gotten with my 6 successful pregnancies. My breasts were sore, I was feeling nauseous, I had food aversions. So needless to say, I was very surprised when I got a positive pregnancy test just a day after I finished a full period. The next thing that tipped me off was I started spotting. And again, this is common in viable pregnancies. However, not necessarily with my pregnancies. I normally didn't spot in any of my other 6 pregnancies, and this spotting was kind of inconsistent. I would, spot a little bit during the day, and then it would stop for a day. And then I'd spot some more, and then it would stop. So that prompted me to get in touch with my OB and get my HCG levels tested. When I got my HCG levels tested, the numbers were high enough that an ultrasound would have shown a gestational sac in my uterus. And so my OB decided to set up a early ultrasound to check to see the gestational sac. When we checked, we couldn't find anything. So that was the next thing that tipped us off. My numbers for HCG said that I should be showing a gestational sac, and it was not anywhere in my uterus. We thought possibly I could be pregnant with twins, which would account for the higher HCG levels, but not being able to see anything at that time. So we went ahead and scheduled another ultrasound in a week. When I came in for the next ultrasound, again, we couldn't find anything, and my HCG levels were continuing to climb at a pretty good exponential rate. So it looked like a viable pregnancy based on my HCG numbers. However, we couldn't find anything. I went home and was feeling some pain on my left side, sharp pains. Now, I know with my past pregnancies, the stretching of my ligaments and my uterus getting ready for the baby, I would definitely feel some twinges, but not necessarily sharp pains. So I don't want you to worry if you're pregnant and you feel some kind of ligament pains on the side of your belly, on the side of your uterus. I don't want you to feel like that necessarily would mean that you're having an ectopic. However, these did feel a little bit different than what I was used to. So I advocated for myself. I called the doctor and I said, I really think we should get another ultrasound. I feel like something's wrong. I'm still spotting. The numbers are going up. Something just feels wrong. And then I explained the twinges on the left side. She got me in for an ultrasound the next day. And sure enough, we saw the gestational sac in my left fallopian tube. So again, the early signs were having a positive pregnancy test after I had a full period. Really strange, inconsistent spotting that would come and go, but never got heavier or lighter. Rising HCG levels with nothing to show for it on the ultrasound, as well as sharp pains on one side of my uterus or one side of my body. And so those were all the things that, I would consider to be direct symptoms of having this ectopic before I even knew that I had an ectopic. So when they found the ectopic on the ultrasound, it was very, very clear and evident that it had grown and it was kind of stressing out my fallopian tube. Now, fallopian tubes don't have a lot of give. They're not like, your uterus that is meant to expand. They don't really expand very much, so you have to be very careful with that. And that's why an ectopic needs to be taken care of really quickly. My doctor decided that we would go ahead and go with the normal routine for an ectopic, which is getting a methotrexate shot in my upper hip. And what methotrexate does is it kind of starves the body of folate, of folic acid. So folate is necessary for the splitting of cells. So of course, when you have a fertilized egg, the cells continue to split, and that is what continues to help grow the fetus. Now, when you take away the folate or the folic acid, then those cells stop splitting and it just kind of goes away. And that is the thinking behind the methotrexate shot. So I got that, and then I was told that I need to come back and keep getting my HCG levels checked, because what it's supposed to do is stop the pregnancy from progressing, the cells from splitting, and then you'll see the HCG numbers going back down again. And then you know that it's not growing anymore and not stressing out your fallopian tube, and then that is what takes care of the ectopic pregnancy. Now that did not unfortunately work for me. Now this is a very effective way of handling an ectopic pregnancy, and most pregnancies do respond to this treatment, but it is normally in direct correlation with how high your HCG levels are for the success rate of the methotrexate. So my HCG levels were on the very, very high end of the methotrexate being able to work. You know, I didn't get seen right away because I assumed that I was having a normal pregnancy. So normally if your HCG levels are not responding to that first dose and they continue to rise like mine were, they will give you a second dose. I think they wait a week and then give you that second dose to see if that helps. Unfortunately, mine continued to go up and I didn't make it to the second dose before my fallopian tube ruptured. So I wanted to real quick tell you what that felt like, because I think, you know, if you are going through an ectopic pregnancy, knowing kind of what to look for is very important. It was not like a instantaneous, oh my gosh, I think it ruptured type of thing. It was, I was working and I was on my feet a lot, and I just started feeling more sharp pains in the same place that I had been feeling them before. And they became a little bit more pronounced throughout the day and sharper. That night, I was in quite a bit of pain. I was unable to lay down and nurse my baby, which I normally nurse her to sleep. I had to, you know, prop us up and get her to bed. And then when I went to bed myself, I could not lay down. I couldn't lay on my back. I couldn't lay on my side. The pain was so intense that I could just sit up. The reason I wasn't so alarmed is because they do tell you when you get your methotrexate shot that you can go through a certain amount of pain as it's working. So, you know, your body is adjusting to the folate being stripped away. It's adjusting to, you know, the change in your fallopian tube. There's a lot of adjustment going on, and I was just wondering if possibly it could be just the methotrexate working. I was hoping that that's what it was. Unfortunately, that was not what it was. That particular night that I could not lay down, I propped myself up and was able to fall asleep eventually, only to be woken up by excruciating pain that I would liken to kind of transition pain when you're in labor. It was very intense. I couldn't walk. I could barely do anything. At that point, my husband thought it was a good idea that we head to the emergency room. As soon as I got into the ER, they did an ultrasound and they were able to see the internal bleeding that was going on inside of me. And that is never a good thing. So I do want to stress that internal bleeding is an emergency situation. It is very scary. It is very, very painful, and it is most definitely an emergency situation. So you need to be very aware of this, and if you feel pain and you know you're going through an ectopic pregnancy and it is very sharp, please go in and be seen. I think this is very important to note, because if you do happen to have a ruptured ectopic and you feel this intense pain like I was talking about, and then it goes away, that doesn't necessarily mean that you're getting better or that it didn't rupture. So if you feel the pain, please be seen. Very, very important. As soon as they saw the internal bleeding, they scheduled me for an emergency surgery within just a couple hours, monitoring me through the whole thing. They had to fit me in. And they got me taken care of very quickly. It was only about an hour surgery. It was laparoscopic, and which was, relatively non-invasive and easy recovery from everything that I had heard, because I was doing copious amounts of research while laying in bed waiting for my surgery. They took my left fallopian tube. I was able to keep my left ovary, which I was grateful for. And I was able to go home that night. I was very pleasantly surprised at how fast they were able to get me in, get me taken care of, and home that night. I ended up going home with 3 incisions, one in my belly button, one over where I would have thought my left fallopian tube was located, and then one down on my pubic bone area. They were sore, a couple stitches in each, I'm thinking, and it took a few weeks for them to heal and not be tender. So, I couldn't wear jeans or anything tight for a few weeks, but they healed up very quickly. So the at-home care was very simple. I just had to be, careful with the things that I picked up and not to bend a certain way or rub on that area. But otherwise, it was a very, very quick and easy recovery. And I'm very grateful for that. Okay, so that was the physical part of it all. The emotional part is a whole different story. As with any pregnancy loss, which most definitely this is a pregnancy loss, there is an amount of sadness, and with this one in particular, and I've gone through a few miscarriages, with this one in particular, it was exceptionally hard because of the persistence of, this fetus to grow. And I was just so shocked that it just wanted to grow so badly, but it was in the wrong spot. And there was so much almost guilt and sadness around having to end this pregnancy in order to save my life, in essence. And that's not being over dramatic. Had the internal bleeding continued, I would have died. So there was just a lot of emotions tied up in this particular situation. So if you are going through this, please give yourself the space, the permission to mourn. This is a very hard situation to go through, both physically and emotionally, and I empathize with you. I feel like the physical part was challenging, the emotional part was 100 times more challenging. So please do give yourself the space to mourn this. And if you are supporting someone or caring for someone who's going through this, my best advice to you is to just be there. Just be there for them. Be there to listen. And let them know that you're there to help them and to be a shoulder to cry on if they need it. Please don't say things like, well, at least you have X number of kids, or at least you still have one fallopian tube. I know these are well-meaning comments, and comments that are, of course, looking on the bright side, being optimistic, but these really aren't helpful for someone who is going through an ectopic pregnancy loss. So I just wanted to throw that in there because I know some of you may be watching with a spouse or friend, or maybe you are educating yourself on what someone you care for is going through, and that is my best advice for you on that. So be there for them. Acknowledge their loss. And if you are going through this yourself, please acknowledge the loss that you're experiencing and give yourself time to heal from it, both physically and emotionally. So if you're going through this, again, I'm sending you virtual support. I'm sending you love from afar and empathy. I'm so sorry that you're going through this. But I hope this was helpful. I hope this might have helped educate you on what to look for, to be proactive with your doctor. If you feel something's wrong, if you're nervous that something's wrong with your pregnancy and you might be experiencing some of the things that I've talked about, call them. Tell them that you want an ultrasound. Tell them that you want to check your HCG levels too. you need to advocate for yourself to make sure that you're healthy. And this is very, very important. You're not going to hassle them or bug them, but you need to be in charge of your health and taking care of yourself. And so please be sure to advocate for yourself. So again, I hope this was helpful. If you're going through this, I'm sending you love and support. And if you have any questions that I haven't mentioned in this video, please feel free to leave them in the comments below. I will definitely try to get to them and answer them for you. But thank you for watching, and until next time, be well.